So today I'm going to try out a new piece of technology that looks inside the breast to understand lumps better. So it's really common that if you discover a lump on a mammogram, discover a lump on an ultrasound, they have kind of limited information to go on. This technology has ultrasound plus a laser, and the laser can give you more information about the lump to help you understand more about exactly what that lump is. So I have a fibroadenoma, and so I'm going to be able to try out this new piece of technology to really understand more about this lump. So I thought I'd bring you along. I'm a little bit of a science geek and I love to learn how these things work. So I thought you might enjoy coming along with me. So something that I think would be useful to understand is just the basics of how an ultrasound works in the body and how lasers work in the body. So an ultrasound uses sound that you can't hear, and that sound can travel through the body and then it bounces off in a certain way on different things. And that's what creates an image. So a laser is light that you can't see that can travel through the skin. So, have you ever put a flashlight up your nose and you can see it glowing inside your body, right? It's like that in a way, but what it's doing is it's shining a really, really tiny, fine light that can go through the skin. And it's going to reflect, scatter, refract off things differently. So what this laser is geared to do is it knows what oxygen looks like when the light bounces off of it. So if you had a flashlight on a mirror, you're going to expect it to bounce off a certain way. If you put a flashlight on a disco ball, it's going to reflect differently too, right? So that's the thing. So it's taking this idea with using sound, so that's the acoustics, and then using a laser, which is the opto part of the optoacoustics, and using both of those wavelengths to be able to figure out more information about what's going on inside the body without having to do a biopsy. All right, so I've got my gown, and because it's laser, I get to wear these cool glasses because, safety first. This is feeling a little bit like a superhero moment. It's like, is this my cape, or am I about to catch a baby falling from a skyscraper? Like I'm ready. Alyssa is a trained sonographer, and she is going to be doing my exam. So how's the exam going to work?
So we'll go ahead and start with just your traditional ultrasound. Take a look at that lump wherever it's at, and then once we figure if we target it, we'll go ahead and turn on our lasers to get that optoacoustic imaging. The OE system has built-in safety measures to only allow laser emissions if skin contact is present. Here we have put on our protective eyewear and have placed warm gel on the breast to allow me to locate the area of concern in her breast tissues with the OA duplex probe. I will move the probe in two different directions over the area of concern. The OA system displays various color maps with additional functional information. For example, the green colorization represents oxygenated hemoglobin, while the red colorization represents deoxygenated hemoglobin in and around the breast tissues. Based on the characteristics captured, the physician can make a confident diagnosis in the area of concerned image. Optoacoustic scan.
That's it. That was much better than a biopsy. Step is that this information is going to be sent to the physician who is an expert in reading these things. So far, the indications don't show anything that's suspicious. What I really like about this is that it's just more information for us to use, right? So for a fibroadenoma, the typical thing that they do is monitor this, where they would say, okay, this hasn't changed shape, this hasn't changed size, so this must be a fibroadenoma.
We can see that there's a vessel, this red vessel. Can you see what I'm pointing to?
Mm-hmm.
So that's part of the definition of a papilloma. So I went through and I scored it. So if the differential were cancer versus fibroadenoma, that's low enough that I would call this BI-RADS 2 and say you can just go back to routine screening and you don't need any follow-up studies. But papilloma sometimes can become malignant. So I think this is a benign papilloma. I would keep it by REDS 3. I don't think you need 6-month follow-up ultrasounds, but when you go in for your annual mammogram, I would get an ultrasound at the same time.
Do you feel like you're getting more information from this type of exam versus what you were getting previously? I mean, does it help you feel a bit more reassured or?
Yeah, definitely, because it's always strange to hear as a patient, we're pretty sure it's probably this,